Shane, tell everybody about Euromonitor International. What is it?
Yeah, Euromonitor International, we're a strategic market research agency, so produce data on about 30 largely FMCG, so CPG industries. Despite the name, we're a global organization, so have about 16 offices, do annual research in about 100 markets, have the capacity to do bespoke or customized research in virtually any market in the world except the ones that our banks tell us we can't research in. And we're producing annual data on market landscape size, share, distribution, and then also producing customized bespoke research for our clients in areas where the syndicated data set doesn't provide all the answers. They need to go deeper, emerging areas, etc.
And the brand is really highly respected.
Yes, thank you. Well, we do our best, yeah.
Let's dive into what I think is going to blow people's minds. Tell us about the Passport 2025 report.
Yeah, so if I can start maybe in 2000 rather than 2025 briefly, we've been researching the tobacco and nicotine industry for about 25 years across those 100 markets. Most of the research that we do is on legal categories, and we started researching the e-vapor market in about 2014 within the syndicated data set we have, and again focusing on what you could define as legal at that point in time. And in the intervening periods between then, in that decade or so, it just became increasingly obvious that when we were focusing on legal sales only within the e-vapor space, we just weren't capturing the whole picture. And we were getting pushed by our clients and by our stakeholders to look at the illicit space. So that's something that we added in 2025, a view of the illicit e-vapor market across those 100 markets. And we were expecting it to be large. That's why we added it to the research spec, but really the results I think were quite staggering in terms of the share of illicit consumption in the e-vapor space. And like you say, I think it's something that takes everyone by surprise really when they see the figure, even those who are familiar with the category and familiar with the trends and the patterns in the market in terms of illicit consumption.
Looking at the report, the number is $47 billion is the illicit portion of the global e-vapor market.
Yeah, so depending on exactly how you cut the pricing or make assumptions about pricing, the total e-vapor market we think is about 60 to 65 billion globally, and of that the illicit portion is about 45 to 50 billion, so somewhere between 70 and 75% of all e-vapor consumption globally is in the illicit or non-compliant space, which is obviously, it's a very significant figure. There are very few other, if any, FMCG categories that have that problem or that pattern globally, so it really makes the e-vapor category unique amongst FMCG. FMCG categories even within the nicotine space, but certainly more broadly as well across the landscape. So yeah.
How quickly has that grown?
Well, it's grown. And this is where we get into the function of or the drivers of illicit or non-compliant. It's grown very quickly as regulators have started putting regulation in place, because obviously almost by definition you can't have illicit or non-compliant consumption without regulation. And when the category was first emerging in the sort of late 2000s and early 2010s, there were some markets who were very quick to come in and prohibit or try to prohibit, but generally speaking, there was a more laissez-faire approach from regulators. And as regulators have come in and started trying to restrict, as they've come in and started putting excise on the category, etc., that's what's prompted that shift into the illicit or non-compliant space. And as a result, it's grown rather quickly since then. The data we have in the illicit space goes back to 2023 only, because it's very difficult to go further back and retroactively construct a data point from that point in 2025. But you can see that it's grown very rapidly once regulation comes in and starts putting in place those kind of categorizations or features of products, or registration frameworks or things that brands need to do to be compliant. Once that starts happening, the non-compliant consumption grows very quickly then.
So when you talk about this research, how surprised are people to find out that 75%, 76% of the entire worldwide e-vapor market is illicit?
It's a data point. I've been with Euromonitor nearly 15 years now. I've very rarely seen anyone react as strongly or as viscerally to a data point. It's one that people are really shocked by in many cases. I presented some of this data for the first time in Geneva at the World Tab Expo last year, and there was gasps in the audience when I flashed that data point up on the screen, which again I've never really come across in the time that I've been researching or presenting research. So it's a strong reaction, as I said, even amongst people who think they know the industry and think they know what's happening. Once they see the kind of research in black and white, it has been something that's shocked people, yeah.
Where does the data come from, if you can give us an idea?
Yes, so as I said, we research in 100 markets within the nicotine space. In each of those markets, we have an analyst who's present in that market, who knows that market not only from a nicotine perspective, but also from a broader kind of consumer and market landscape. We're approaching all of the research we do in terms of the syndicated data we have across industries using what we call a primary and secondary research approach. So primary, for the jargon, refers to speaking directly to people involved in those categories in that market. So it could be brand owners, could be distributors, could be trade associations, could be governments in certain instances, and so on. So anyone who has a view or an angle or an opinion or has knowledge of that category in that market, we're speaking to them and gathering their intelligence about the category in that market. And then at the same time, the analyst is also looking at anything that's publicly available from an information source perspective. So again, could be company releases, could be government releases, could be trade press in certain instances, etc. And effectively, our analyst then is triangulating that and building a kind of consensus of all estimates in terms of the data we're building. When it comes to the illicit space, obviously it's more difficult to go and speak to a distributor of illicit product. We're not going to put our researchers in that position. So we also layer in things, that could be things like gap analysis, looking at, total user populations and what we expect a market volume should be given the number of people that we know based on health or government surveys are using products in that market, and then looking at the difference between what we can establish the legal market is and what we expect or believe the total market should be. We also do things like store audits and product audits and look at when you look at the shelf space, how many of those products we believe are legal or compliant in a given market, etc. So it's a combination of all sources. I think for obvious reasons, the illicit space is more difficult to research than a legal space. The illicit e-vapor space is even more difficult again than researching something like the illicit cigarette market, where you can do empty pack surveys and so on that have a fairly high degree of statistical significance, I would say, or accuracy. That's not really possible in the illicit e-vapor space. So it is something where we're bringing as many different estimates, multi-methodology approach to it, and what we're trying to do is produce estimates where there are none right now.
Are there some markets that are worse than others?
Yeah, so obviously when we look at it, we sort of bundle or categorize markets into three different brackets. There are markets where there's still no regulation on e-vapor products, and where there's no regulation either specific to those products or which bring them within a broader kind of tobacco regulation framework, and we categorize those as 100% legal in terms of the consumption that's there, so it's a bit more straightforward. There are then a number of markets that obviously outright prohibit e-vapor products or certain form factors within the e-vapor product family, so to speak. And again, we categorize the consumption within those markets as 100% non-compliant or illicit. And about roughly speaking, about 15% of all illicit consumption, or all e-vapor consumption globally rather, happens in markets where there's an outright prohibition. So 1 in every 7 e-vapor consumption moment, roughly speaking, globally happens in a market where the products are not legal. And then there is a third bucket of markets where there is regulation in place, and there is therefore a framework which dictates one brand and product may be legal, one is not legal, etc. And that's where we're going and looking at the mix between legal and non-compliant. There are a number of markets where we see 100% illicit consumption, obviously where there's prohibition. There are markets where there's de facto regulation in place, and it is theoretically possible to have a legal product in the market, but because of the severity of the regulation or the lack of enforcement, etc., we see virtually the market is entirely illicit. And there are markets like Israel, for example, where where there is effectively 1% of the products we estimate are legal and 99% of the products are non-compliant. Markets in GCC, UAE, Saudi Arabia, etc., again, in principle, have a compliance framework where it is possible to put a legal product on the market, but virtually all of the products consumed are non-compliant or illicit. Yeah.
So how does the US then measure up? Because you've got, tens of millions of users of vaping products, and you've got like a very small handful that are actually been authorized. Yeah. So is the US not one of those markets?
Yeah, so from a volume perspective, the US is without question the biggest illicit market globally, because as you say, the scale of the consumption there are probably thousands of SKUs in the US, possibly in the high single-digit thousands of individual SKUs, and only a small fraction of those are legal because they've gone through the full FDA process and acquired a marketing authorization. So. It's an extraordinarily large problem in the US, and really the US is driving, from a volume perspective, the majority of illicit consumption or non-compliant consumption globally. We have seen, and I think it's reflected in the latest data, we have a little bit of an improvement in that situation. There's been more of a focus on enforcement. We've seen, obviously, an apparent change in the approach of the FDA to things like flavor and so on from an authorization perspective. So it appears to be improving to some extent, but there's still, the vast majority of consumption in the US is still non-compliant or illicit as we see it. Yeah.
So it makes a big contribution to that number.
Yes, exactly. It's the single biggest market from an illicit and non-compliant point of view, because of the scale of the consumption there.
So many of those products across the border in Canada are legal. So they're not illicit. It's just because of this wacky, crazy system the FDA has that makes that the case.
Yeah.
What do you think?
Yeah, so it's absolutely the case, and we see that market by market. There are products, you can, in certain parts of the world, there's products that are legal in one country and not legal in the country next door, etc. So it's definitely an issue. It's something maybe we can, in terms of how you address this, I think standardization across markets is certainly one of the potential ways you can address an issue like this. But from our point of view, from a research point of view, the answer to that is, we never put a board up and say this SKU is non-compliant, this SKU is compliant in all markets. What we're doing is looking at it on a market-to-market basis. We're understanding what the framework is in that given market, both in terms of any regulation that's there around the product feature, so nicotine strength restrictions, volume restrictions, etc. Anything to do with distribution or access. So is there an online sales ban or anything else that's restricting access to the product? And then we also look at things like registration. So if there's a registration framework in place, how many brands and what brands have actually fulfilled or complied with that registration. So we're looking on a market by market basis. Our analysts all produce a one-pager which describes the regulation in that market and effectively is a criteria against which they're kind of judging in terms of how many products or brands are sitting in the compliant versus non-compliant space, etc. But in that sense, there's no universal definition of compliant and non-compliant in the e-vapor space. So it definitely adds to the complexity of the research, and adds obviously to the complexity of the landscape overall from an operational perspective too.
So there's, I guess, a couple of different parts of what drives something being illicit. One could just be the actual regulation itself in one country makes a product illicit, whereas across the border it may not be.
Yeah.
And then you have the actual prohibitions and restrictions and bans that are, heavily about enforcement and keeping the nicotine away from people very directly.
Yeah.
Where I don't think in the US that's the case so much, because, you can obviously get the products everywhere.
Yeah.
But you have Australia, where it's almost a de facto prohibition.
Yeah, there are markets, like I said, that are trying to either heavily restrict or prohibit access to the products. I mean, I think based on the research we do, it's questionable as to whether that is successful or not, really, because as I said, 15% of all e-vapor consumption globally happens in a market where there is strictly no access to the product. so that's not a measure of the success of prohibition, I think, in terms of reducing access to the product. So, consumers will get access to these products, I think, almost whether people intend they do or not. And we can see that in Australia. As you say, there's a very restrictive set of regulation in place. It's intended to reduce access to the product, and yet it's widely available. We can see use in markets like Singapore, for example, where again the category is prohibited, and Singapore rightly in many cases held up as a market or a territory that can restrict access and can control access to products, etc. And yet again in a market like that we're still seeing consumers being able to acquire e-vapor products and so on. So there is this desire, I think, yes, to potentially restrict or control access, but on the basis of the research we do, it's hard to say that that's successful all the time in all cases.
I know you're a research company, so you may not be able to speak to this, but do you have a sense about what's driving government and public health to push these bans and restrictions?
I mean, as you say, we're a research company. I try to look at this impartially, objectively. I think in part, it feels to me there's a few different factors in play. One is, in certain instances, I think it's been prevalent in what you might call developing markets for many years, although actually I think we're beginning to see it in some Western markets as well, where regulators just say, look, we don't have the resources to deal with the complexity of these products. We don't have the bandwidth almost to look at what the appropriate regulation is, and therefore we're just going to put a blanket prohibition in place and try and deal with the issue that way. So I think that's one of the reasons why we're seeing it. There are also regulators or those in public health who I think sincerely believe that people should have their access to nicotine restricted for whatever reasons. I think there are obviously differential views on the science around nicotine, and I'm not an expert in that area. But it feels to me like there must be people who are operating in good faith in terms of saying, look, we feel it's beneficial for a population that their access to nicotine is restricted and so on. I know there will be many at this conference, and almost all, who will disagree with that. But I think it's worth recognising that there probably are those in good faith who are operating in that way. And then I think there are others who, within the public health community, and then are influencing regulators and so on, who disagree with things like the profit model for a substance like nicotine, who do not like the idea of big tobacco companies being able to continue their revenue streams through these products, and are really trying to create non-nicotine markets and non-nicotine societies. And I think, again, looking at it from an objective point of view, it's not always clear that objective is communicated clearly, and I think that may be one of the issues here, is that we have regulators or people advocating regulation through that motivation when that's not always clearly stated. And I think it's always best probably to be clear and transparent about the rationale for regulation. Then maybe people can look at it in a slightly different way and debate and discuss in a slightly different way as well. But I think those are probably the three. There's in part it's a lack of resource and a desire just to kind of try and almost perhaps postpone dealing with the problem. There will be some who are genuinely of the belief that this is the best way to deal with the problem, and then there are others who are perhaps trying to create a future that isn't always clear to everyone.
So this number, around 47 billion US illicit e-vapor market, what does that say about consumer demand?
Yeah, so it's strong. I mean, again, if you look at it just from a volume perspective, e-vapor accounts for now about that 15% figure. So about 1 in all 7 nicotine consumption moments now, including cigarettes, etc., globally, is in the e-vapor category. So it's obviously a product category that's strongly appealing to consumers, and there is clearly a demand there for the category, and the consumption data that we have and that value data speaks to that without question. And I think I would also add that when you look at that 60 billion, to a large extent that's non-tax inclusive right now. We're seeing more and more markets taxing the e-vapor category But by and large, up until now, there hasn't been significant excise in place. So if you start to see markets bringing excise into the mix, that 60 billion figure overall from a tax inclusive perspective, increases potentially relatively quickly. And then also obviously has the risk of increasing the arbitrage between the legal and illicit market as well.
Right. So the taxes do push a lot of people into that illicit market, even when product is still available in their market.
Yeah. So up until now, like I said, excise hasn't been as much of a feature of the e-vapor space as in the cigarette space. And again, I think that's either been because governments have just been slower to get to the pitch in that sense, or in certain markets, again, there's been a recognition that these products are potentially safer for consumers, and there has been a desire to go lightly in terms of excise. But we are seeing more and more markets now increasing excise on e-vapor. I mean, Poland is a good example where we are right now. There was a relatively big increase in e-vapor taxation introduced, and that has led already to more consumers moving into the illicit space. So the drivers are not homogenous all the time for illicit or non-compliant consumption. You do have a lot of product-led or product-driven consumption in the sense that consumers are trying to access product that isn't available to them in the legal market. But we're increasingly seeing price as a factor as well in terms of non-compliance. And it's again a feature of the category that we've seen in many markets. And again, if you look at the UK, for example, where there's also been, or there will be an excise increase on e-vapor, a lot of the shift into the e-vapor category from the cigarette category has been price driven. It's consumers who are price sensitive. They recognize that e-vapor offers them a more affordable way of accessing nicotine, and they've moved into the category on that basis. So they're even more sensitive to price in that sense, and anything that kind of increases the relative price of e-vapor, decreases the gap between e-vapor and other categories, potentially will fuel that non-compliant or illicit consumption even more.
It was a huge driver for me in Canada, switching, making the switch.
Yeah.
Because I was a 2-pack a day smoker,
yeah.
And by 2015, that was $30 a month or a day.
Yeah.
$30 a day. I mean, I couldn't afford it.
Yeah.
I mean, it was a mortgage payment.
So it's an important, it is an important public health discussion, I think, in terms of where the appropriate excise level is for a category like the e-vapor category. I think there are good reasons to levy excise in it, not least in terms of trying to combat the non-compliant consumption, because if you flip it around the other way, the issue at the moment is that there isn't a great incentive for governments in many cases to actually enforce against illicit e-vapor or non-compliant consumption in the e-vapor space, because they're not losing tax revenue because it's not there in the first place. So I think there is probably a Goldilocks spot where there's enough excise on the category that you're raising revenue for governments, that you're potentially again protecting vulnerable communities in terms of making sure that, for example, it's less accessible to children and so on, and that there's enough incentive there to enforce against illicit consumption. But again, obviously, if you pitch that level too high, it can have a counterproductive effect of driving consumers into the black market.
Here at the Global Forum on Nicotine, you're presenting some stuff. Why is an event like this important?
As we've discussed, this is a complex industry, a complex landscape, and it's one in which it's difficult, I think it seems to me, to get the solutions right and to find the right way forward. So I think an event like this is very important to kind of air those complexities, discuss them, try to learn from different parts of this puzzle. There is a role for research to play in this, there's a role for industry to play. There's certainly a very strong role for public health and regulators to play in this space as well. So I think a forum like this, which tries to bring those different parts of this together, and obviously the consumer as well, and having the consumer voice, which is a notable feature of GFN, is important too. So bringing all of those different stakeholders together, I think, and trying to build consensus around the right way forward. There's a lot of, again, looking at it almost, I'd say, externally or objectively, as we try to do as a research organization. It feels to me like there's more agreement often than is highlighted in terms of not wanting to make sure that these products don't get into the hands of vulnerable communities and so on. I think everyone is aligned with that. And it's really around trying to find a way forward that balances those different competing interests. And I think there is a path forward. It's narrow, but I think events like this can help, in making sure that different parts of the stakeholder set here is aligned in terms of how to go forward.
If you had a moment to give governments around the world some advice, what would that be?
Well, I'm not, as an observer, I'm not usually in the business of giving unsolicited advice, but I think there are a few things. I mean, certainly as a data and research person, I would say, there is data and research in this space, and I think it's important to look at that data and research and make sure that, regulatory frameworks that are being proposed are being built in the context of the appropriate data and research. So I think, I would say that as a research person, but I think that's an important first step. And again, it's not always been the case, I think, with every framework that's been brought in that's so. I think one of the other aspects of this as well is we didn't quite get into it during the conversation, but the gap between the regulation and enforcement, I think, is very, very large at the moment. What we're seeing is regulatory frameworks being put in place, like in Australia, and then a lot of money being thrown at enforcement against those regulatory frameworks, and the enforcement is just not successful because the gap between the framework and what's possible from an enforcement perspective is too large. So again, there are notable exceptions to this, but I think in general terms it's not always clear to me that there's a consensus or alignment between regulators and enforcers, if I can use that word, in the building of regulation. That's something I think that would be beneficial. And then in a broader sense, again, there are wider groups here that have a lot of knowledge of markets, that have a lot of that have a view and lived experience in terms of either industry or consumers. And I think, again, it feels to me that it would benefit the regulatory frameworks to have those voices appropriately embedded into some of those. And again, there are issues around the involvement of industry in certain cases, and I respect that in terms of what individual regulatory bodies want to do. But again, to whatever extent it's possible to broaden the input into regulatory frameworks in this area, which is a complex one, I think would be beneficial.